unfortunately, in that realm, I think there's more questions than answers, but areas that I think are undergoing study and need more work done. Certainly the molecular profile of young patients, that's something I'm working on in collaboration with Ross Levine and Ranjit Rampal, thinking about what are the drivers in young people who don't have a known driver. So in that triple negative population, also thinking about secondary mutations and other mutations that can be acquired that can affect risk of prognosis, affect outcomes. So those are things we're looking at in our young patients. Risk stratification, normally anyone sort of under 60 potentially is considered lower risk. And I don't know that you can quantify that as a 53-year-old and a 20-year-old are necessarily the same. So thinking about, how do we risk stratify young patients? Certainly questions about management, when to cytoreduce, what drugs to use, things like quality of life and symptom burden are things we're studying in young patients. And then something I'm working on with some colleagues is starting to think about women's health in sort of that AYA population related to various elements that maybe aren't things you think about with a 70-year-old patient or with male patients. So thinking about things like menorrhagia and bleeding and clotting in young women and the treatments for those. And those are things we're starting to really try to study more.